Good evening to everyone here. I want to thank you again for joining me tonight and welcome to our online discussion. Again, this is your host and speaker, Lawrence. I am your anxiety nurse. Let us proceed. Today, I want to discuss about anxiety. It's been 3 years since the pandemic began. It brought so many changes in our life. There were many events like political issues, social issues, recession, war, calamity, and many more. This has brought so much stress and fear to our lives. Mental health disorder has increased significantly during this period. In fact, global prevalence of anxiety and depression increased by a massive 25% according to a scientific brief released by the World Health Organization. So to address and shed light about this issue, it would help us to discuss this issue further. So what is anxiety? Anxiety is a normal part of human emotion. It's your brain's way of reacting to stress and alerting you of potential danger ahead. Everyone feels anxious now and then. However, if it continues to affect your everyday life and make you feel in a constant stress every day, exhausting you by disrupting your sleep and eating pattern, then you might be suffering from one of anxiety disorders. So before I discuss this further, I want to discuss to you one of the most important things in order to understand how anxiety works. And this is our autonomic nervous system. So this is a typical picture of an anxiety person who is suffering from anxiety attacks. So we will proceed again to the next slide. Okay, so what is autonomic nervous system? Our autonomic nervous system is a network of nerves throughout our body that control unconscious processes. These are things that happen without you thinking about them, such as breathing and your heart beating. Our autonomic nervous system is always active, even when we are asleep, and it's key to your continued survival. However, the nature of our survival instinct is so primitive at times that it can't distinguish between what is normal and what is in danger. We will discuss this further. So, our autonomic system, nervous system, is very important in our discussion for tonight since the anxiety symptoms uh, will also is also related to our autonomic nervous system bodily function. So, I will discuss this further. Let us discuss how stress response get triggered. So here you can see the stress response begins in the brain. So when someone confronts an oncoming danger, let's say a fast approaching vehicle, now our eyes and ears or both send the information to the amygdala, an area of the brain that contributes to our emotional processing. This is the first center of our brain. So, as it interprets the images and sounds, when it perceives danger, it instantly sends a distress signal to the hypothalamus, the command center of the brain. This will trigger the release of hormones necessary to trigger our flight and fight body response. So through the activation of autonomic nervous system, specifically our sympathetic nervous system, as you can see here, sympathetic response or flight or fight reaction, so plus the fear and danger thoughts that would initiate the physical symptoms arousal. So we will discuss what are the bodily response specific to each type of autonomic nervous system. So to tell it in a easy way, the sympathetic nervous system functions like a gas pedal in a car. So it triggers the fight or flight response, providing the body with a burst of energy so that it can respond to perceived dangers. It is the system that activates body processes that help us in times of needs. While on the other hand, the parasympathetic nervous system is the rest and digest process of our body. So it acts like a brake to calm down our body after the danger has passed. So, going back to how anxiety works, I said before that our brain can sometimes trick us, and due to constant stress in our life, it triggers an ongoing cycle of stress. So, even when there is no danger, our amygdala is hyperactive, making the cycle go over and over again without perceived danger. So what are the bodily response of our body during this scenario? So I want you guys to familiarize your self uh, on the left side of the picture. So we have here the bodily response of sympathetic nervous system. It is directly related to our anxiety symptoms. So sympathetic nervous system, increased heart rate, increased respiratory rate, airways dilation, kidney release adrenaline. It also inhibits digestion. So some of you who have gastroesophageal reflux, it makes you feel bloated. It also might be directly related to your stress or anxiety response, as well as your constipation, because it inhibits your intestine movement. But please do correlate and consult your doctor before diagnosing yourself, because we have to rule out any other possibilities, any physical possibilities of you having other medical causes, such as during sympathetic nervous system and a panic symptoms includes chest pain and palpitations. So please do consult your doctor before self-diagnosing yourself. So on the right side, we have the parasympathetic nervous system, which acts as opposite, because they are like inversely proportional to each other. So decreased heart rate, a decreased respiratory rate, and it promotes digestion, stomach, and intestine movement. So please familiarize yourself with this, because it will help you understand how your anxiety works. So next, these are the symptoms of anxiety. As I've said earlier, panic, fear, uneasiness, sleep problems. This is the most common problems that I often heard from my followers and clients. They feel like they are overthinking, can stop themselves thinking over and over again. They are having problems with their sleep and overstimulation of their brain. So we will discuss insomnia in another time. So to discuss that thoroughly. So breathing faster than you usually do, cold, sweaty, and numb palms. So tinglings, hands or and feet, shortness of breath, as I've explained earlier, and then problem in concentrating and overthinking. So those are the symptoms of anxiety that is directly related to the sympathetic nervous system bodily response. So please review this slide again so you can have the knowledge and information about how anxiety works. To proceed, so we have here the types of anxiety disorder. So this will be discussed more for next discussion. For more thorough explanation, this will be discussed next time. But let us just take a glimpse and be familiarized with what term our doctor and psychiatrists can use to diagnose a person who suffer from anxiety. So we have here is generalized anxiety disorder. It is a type where you feel excessive, unrealistic worry and tension with little or no reason. Panic disorder, you feel sudden, intense fear and brings on a panic attack. During a panic attack, you may break out in sweat, have chest pain, and have a pounding heartbeat. These are your usual signs and symptoms when you go to emergency room when you experience panic attack. Sometimes you may feel like you're choking or having a heart attack, where in fact you are suffering from um, panic attack, not heart problems. So social anxiety disorder, also called social phobia. This is when you feel overwhelming worry and self-consciousness about everyday life situation. You obsessively worry about others judging you, and so you are afraid to go outside, speak in front of many people, and present during your report classes and presentation at your work. Specific phobias, fear of heights, riding on an airplane. It is the fear that goes beyond what's appropriate and may cause you to avoid ordinary situation. Separation anxiety. Little kids aren't the only one who feels scared or anxious. A person who is working remotely away from their loved ones, like a soldier, an expat, an overseas worker, like nurses, travel nurses, doctors, they can sometimes develop this separation anxiety issues. And most importantly, medication induced anxiety disorder. Use of certain medication, recreational drugs, illegal drugs, or withdrawal from certain drugs can trigger some symptoms of anxiety disorder. So, if your lifestyle include this use, then you are at high risk of developing anxiety disorder later on your life. So please be careful and be um, aware. So what are the triggers and causes of anxiety? So number one, we have genetics. Anxiety disorders can run in families. Number two, medical conditions. Heart, lungs, and thyroid problems, hyperthyroidism conditions can similarly lead to anxiety disorders. So in this scenario, the anxiety is secondary effect of the medical conditions. So brain chemistry, as we discussed earlier, the amygdala and the hypothalamus, there are faulty circuits in that brain that controls the fear response and emotions. So that is also a cause. Environmental stress. This refers to stressful events you have seen or lived throughout your life. So maybe you are a victim of child abuse, sexual abuse, neglect, or experience a death of a loved one during at early age, attacked or seeing violence. So We have the PTSD here. Drug withdrawal or misuse, again, this anxiety disorder often goes hand in hand. So with alcohol and substance use and recreational drugs use. So please be informed and stay away from this if you have been diagnosed with such anxiety disorder. So to continue, risk factor, trauma, sexual abuse, negative life events, severe or chronic illness you are afraid, like when you develop HIV or cancer, that triggers your fear response to go haywire. Substance abuse again, low self-esteem, bullying when you are a child. So you become shy and afraid to mingle with other people. So thus it develop a social anxiety disorder. So next, we will discuss about the treatment. Anxiety disorder treatment. So what we have here is medications. These are the kind of treatment that only our doctors and psychiatrists can provide. Antidepressant, benzodiazepine, beta blockers, anticonvulsants, and antipsychotics. So these medications do have side effects, so please correlate or consult your doctor. We will discuss this again uh, in our next topic. So remember that medication is not the only way to treat this problem. We also have the psychotherapy, which is the cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment therapy. We will also discuss this thoroughly. So familiarize yourself with psychotherapy because this is a very vast topic and very important steps uh, to tackle in dealing with any mental health issues. So next is lifestyle. So lifestyle, because anxiety is not only a problem mentally but also physically. So remember, as our bodily functions, as I've discussed earlier, so lifestyle can contribute to the um, stimulation of hormonal balance and neurotransmitter smooth uh, smooth flow or smooth what do you call this, smooth function. So we have exercise, diet, education, journaling, socializing, and please also consider limiting your caffeine intake. You don't have to cut it all together, you just have to limit it, and this will help your body to balance your stress response, because caffeine can stimulate our stress response in a way so that it makes you feel jittery and at edge. So please consider also that. And meditation. Did you know that meditation for recent years, it has become a staple or um, a very helpful management in any kind of mental health illnesses, because meditation helps on processing your thoughts, your reaction to your stressors. So it really helps. And there are studies that any kinds of meditation helps our body to facilitate stress relaxation response. So the most common used and studied is the called mindfulness meditation, and then followed by transcendental meditation, then visualization meditation. But all of these kind of meditations are equal. So it depends on what you are accustomed to. And this will also help you to um, helps your rumination, because ruminations are part of anxiety. So ruminations, it is a thoughts that keep on bombarding our brain. So it tends to make us more warrior the usual than the usual person. We will also discuss this thoroughly in our next topic. So to proceed, okay, anxiety disorder outlook. So the outlook for people with an anxiety-related disorder is often positive. Treatment may incorporate a range of different approaches, such as self-management strategies, as we've discussed, medications, psychotherapy, lifestyle changes, and then meditation. So during the treatment and beyond, people should also try to minimize their stress levels. That is important also. These approaches can help people manage their anxiety symptoms more effectively and improve their overall life quality. However, success rates may vary depending on any coexisting conditions the person has and the severity of their anxiety. So always work with your doctor. So that would be all. Thank you so much for your time. I hope you learned something today, and I wish you all the best. If you find this video helpful and informative, please hit the like button and subscribe to my channel. And also, I also have a Facebook page called The Anxiety Nurse. Please considering following my page, because I also post daily topics and information about anxiety disorders. And from time to time, I will also post videos that will help you to understand the several mental health issues uh, that our society is facing right now. So I hope you guys, uh, I hope you well. I wish you all well, and then I hope you guys consider my page to your future anxiety reference. Thank you so much, and I appreciate your time. Thank you.